All right, good afternoon, everyone, and welcome to the last seminar in our One Health series for this semester. My name is Catherine, and I'm one of the students in the Graduate One Health course that runs this seminar series, along with the University of Guelph's One Health Institute. I would like to remind everyone that this seminar is being recorded and will be available through the University of Guelph's One Health YouTube channel, and a link will be made available on the One Health Institute website. The recording may also be used by the One Health Institute for promoting and showcasing One Health work being done on our campus. If you have any questions or concerns about the recording or One Health in general, please contact us at onehealth@uoguelph.ca, and I will post this in the chat shortly. So before introducing our speaker today, I would like to acknowledge that the University of Guelph resides on the treaty lands and territories of the Mississaugas of the Credit. And if we think beyond this, in fact, all of Canada resides on traditional, unceded, or treaty lands of First Nations, Inuit, and Métis people. These people have lived in harmony with the land since time immemorial, and there is much we can learn from them when it comes to One Health and our roles and responsibilities to animals in the environment. And may we recognize that this acknowledgement is only a small part of what must be done to seek redress and healing for injustices that happened in the past and unfortunately continue to happen today. So next, it is my great pleasure to introduce today's speaker, Dr. Claire Jardine. Dr. Jardine is an associate professor in the Department of Pathobiology at the Ontario Veterinary College of the University of Guelph. She is also the regional director of the Canadian Wildlife Health Cooperative for Ontario and Nunavut. Dr. Jardine completed a master's in ecology at the University of British Columbia, and following this, she earned her DVM and PhD at the Western College of Veterinary Medicine at the University of Saskatchewan. Research in the Jardine lab is focused on understanding the ecology of multi-host pathogens in wildlife populations. And now I will hand it over to you, Dr. Jardine.
Great, thanks very much, Catherine. I'm going to share my screen. There. Can everyone see that? Okay, and hear me okay? Awesome, thank you. So I really appreciate the opportunity to present today in the One Health seminar series. So thank you very much for the invitation. And I also wanted to thank the students in the One Health graduate course for the great discussion on wildlife health and One Health yesterday. That was really fun for me, and it was a real pleasure to have that opportunity to meet you guys and have a bit of a nice in-person chat. That was great. So I realize wildlife and One Health is a pretty vague kind of, all-encompassing title. And I guess what I'm going to just mention now that I'm going to focus on wildlife disease, including zoonoses and wildlife health and how they fit into One Health. So if anyone needs to leave, it's okay. I understand. It was kind of false advertising to bring you here, maybe. All right. So what I'm going to cover today, I'm going to start with just a brief overview of One Health. Then I'm going to describe some of the issues that we face trying to put One Health into practice when we're dealing with wildlife disease issues. I'll talk about applying a One Health approach to wildlife disease and wildlife disease surveillance and response, and why we need to do a better job integrating the environment into our One Health approaches. And then finally, I'm going to touch on how we may be able to achieve the goal of One Health, which is, optimal health for humans, animals, and the environment. Ooh, that looks funny. It's supposed to be bigger and in the middle, so I apologize. But here's a typical diagram that we use to describe One Health. And I know you've all seen this before, showing the interconnection between humans, animals, and the environment. And I'm just going to make a note here that I'm going to change the diagram a little bit as we go through, and I'm going to, hopefully it'll illustrate how I think about One Health and how wildlife kind of fits into One Health. So we'll change this diagram up a little bit. And so in addition to the interconnection between humans, animals, and the environment, there's also other important components of a One Health approach, which include the fact that it's meant to be collaborative and transdisciplinary, and that it should really be applied at multiple scales, so local, regional, national, global levels. And as I mentioned in the outline, many definitions of One Health include this overarching goal that we should be trying to achieve optimal health outcomes not just for people, but also for animals and for the environment. Okay, and that all sounds marvelous, but it can be challenging to put it into practice. And I'm just going to talk about one example. So here's a photo, three photos of some dead muskrats. So I'm involved in wildlife disease surveillance in my role as regional director of the Canadian Wildlife Health Cooperative. And in 2020, we received reports of these dead muskrats. They were found at Long Point Provincial Park in southern Ontario. And carcasses from the die-off, some of them that were in good condition, were submitted to our lab in the CWHC at the Ontario Veterinary College. And our pathologist made a diagnosis of tularemia. So tularemia is a zoonotic disease. It's caused by a bacteria, Francisella tularensis, which happens to be a bioterrorism agent, also is, as I mentioned, a zoonosis, and has the potential to infect domestic animals as well. We don't see it all that commonly in Ontario, although we do know that it circulates in wildlife. So this die-off generated a fair bit of interest, particularly from local public health authorities. And you can see here some of the headlines and information that was distributed. Disease muskrat, stay away from wildlife. So this is important messaging, right? We want to keep people safe. So they do, in this case, it was very important that they stayed away from the area and away from wildlife. So important messaging. But interestingly, in 2021, we received similar reports of muskrats dying at Long Point Provincial Park. Samples were submitted in this case as well. And our pathologist made a diagnosis that was not tularemia in this case. We detected trauma, pneumonia, parasitic infections, which kill the muskrats, but are not really of significance to public health or domestic animal health in this case. So not surprisingly, the response to these this die-off of muskrats was a little bit different in 21. There really was no response. And that's not actually that surprising in terms of public health, but perhaps in terms of our interest in animal health, we should be concerned about these muskrats. There's evidence from these, you can see in these manuscript titles here that I've copied and pasted into this slide, that there's indications that muskrat populations are declining. And so there may be some issues with muskrat health in North America. Now, our focus on human health is understandable. We're living in a time of increased disease emergence. We hear a lot about zoonotic diseases. And this figure shows some of the pathogens and diseases that have emerged since the 1980s. And in fact, the majority of these are zoonotic pathogens, and about 70% of emerging zoonoses have a wildlife origin. So there is a lot of interest and concern about wildlife zoonoses. And so it's perhaps not understandable that our muskrats, when they've died of a disease that causes, is a public health concern, that raises more issues. And I just wanted to give a few recent examples of zoonotic emerging infectious pathogens and diseases. SARS-CoV-2, thought to have originated in bats, and then highly pathogenic avian influenza viruses, which originate in wild waterfowl. And then even, more recently, there's now reports of SARS-CoV-2 in deer, and there's concern about the potential role now that deer could play as a reservoir for this pathogen. Okay, so I think the links between wildlife health and human health, or wildlife disease and human disease, are pretty clear. And there's always interest and concern about wildlife as sources of disease for humans. And our response to, our surveillance tends to be very reactive. So we react to threats that we know about, and that's similar. So our surveillance is reactive, and our response is often reactive. So we focus again on zoonotic and agricultural pathogens, and our common responses include things like culling of wildlife hosts or public education. And our ultimate goal really is to reduce pathogen transmission between human animals and domestic animals. But focusing our response on just protecting humans or just protecting domestic animals can have unintended consequences for wildlife and for disease transmission. And I'm just going to go through an example that many of you are probably familiar with, but one example that kind of illustrates how culling, for example, can lead to unintended consequences is badger culling in the UK. So in the UK, badgers are a wildlife reservoir for bovine tuberculosis, so Mycobacterium bovis. Bovine TB, it's a serious animal health issue, but it's also a zoonosis. And there's evidence that badgers are involved in transmitting infection to cattle, and badger culling has therefore been employed as a tool to kind of reduce disease transmission to cattle or pathogen transmission to cattle. So when they implemented this program, they found that culling was associated with behavioral changes, not surprisingly, in the badgers. The surviving badgers, there was social disruptions, and it led to increased badger movement, which in some cases actually led to increased transmission between badgers and increased transmission from badgers to cattle, depending on the scale of the culling effort. So that just illustrates some of the sort of unintended consequences that we can have in terms of culling. And also, even something as straightforward as public education, which, we use all the time, can have unintended consequences. So telling folks to be aware of wildlife is needed and to protect themselves. But we also need to be aware of the impact of our messaging. It can lead to increased concerns about wildlife and emerging infectious diseases in ways that erode ongoing conservation efforts. And that's particularly alarming considering we're, going through a biodiversity crisis. The Intergovernmental Science Policy Platform on Biodiversity and Ecosystem Services, or IFBEST, estimates that up to 1 million species are threatened with extinction, and many of these are going to occur within the next few decades. So this is really alarming. And I think we need to keep this in mind. So now just going back to our diagram, I think we can clearly see the links between human, wildlife and domestic animal health. But there's clearly room for improvement in how we conduct our surveillance and respond to wildlife disease issues. And I think I've made another modification I've made a modification here to the diagram because I think it's really important when we're talking about One Health and thinking about wildlife to kind of pull out domestic animals. And so that's the first modification that I'll make to the One Health diagram. Okay, so what can we do? And so some of the actions that we can take to improve our approach to wildlife disease and wildlife health is moving away from our reactive response to when things happen, then we respond, to a more proactive approach that tries to identify harms before they become an issue. We also really need, I think it's pretty clear that we really need to kind of embrace this idea that we're not just worried about human health or domestic animal health. We need to think about the environment, and we need to think about wildlife health as well when we have these issues. But I'm gonna talk a little bit about some ideas for how we might achieve this, and I'm going to start with some of the surveillance and response activities. So one important component of One Health approach to zoonotic diseases is improving surveillance so that we can detect pathogens before they become an issue. And we need to target high-risk hosts for this surveillance. So, there's evidence that mammals, bats, rodents, maybe some primates, and some birds, like water birds, may be involved, maybe higher risk hosts for zoonotic disease transmission. And so we should target those hosts for surveillance activities. And we also know, that viruses, particularly RNA viruses, are more likely to emerge. And so it's, those are the kind of pathogens that we want to target for our surveillance activities. And finally, we want to focus our efforts in the high-risk areas. And these areas are, some of these areas are identified here in yellow. This is a heat map that shows the predicted relative risk distribution of zoonotic emerging infectious disease events after factoring out reporting bias. And you can see here that some of these tropical areas and also urban areas globally are at higher risk for zoonotic disease emergence. Okay, so there are programs that are trying to do this kind of work, target high-risk hosts, high-risk pathogens, and high-risk locations. And one of those programs is the PREDICT program. It falls within the US Agency for International Development, and that's the group that kind of supports the PREDICT program. It's focused on conducting surveillance of emerging pathogens in areas of the world that are at highest risk. And they work in the areas shown on this map here, which you can see nicely correspond to the areas that I showed you in the previous map, previous slide, sorry, with the areas that are considered to be high risk. So as part of the PREDICT program, they work with country partners. I think they're in 31 countries now. And their goal is to try to detect emerging pathogens in animals before they get into people. And so they do surveillance of wildlife as part of that work. Okay, so in addition, for surveillance, in addition to targeting high-risk hosts, pathogens, and locations, it's also important to think about which situations are going to be at highest risk. And then there's a need to target those. And just some example, an example here in a very tiny picture I see, sorry, is a wildlife market, for example. We know that people interact with animals there, and they've been identified as high-risk, specific high-risk locations. But we really need to understand how humans are interacting with wildlife. And that's really important for developing appropriate strategies and identifying appropriate places to conduct this kind of surveillance. So that's a really important part of surveillance. We also need to ensure that there's adequate funding and the lab capacity to support the testing, which is an ongoing issue. We need to do this at a global scale, but we also need to do it at a local scale. And we need to be able to do this in Canada as well. And so there's several, government and non-governmental agencies in Canada that are involved in wildlife disease surveillance, and including the CWHC. And I'm just going to mention the CWHC as an example because that's the one I'm most familiar with. So the CWHC works across Canada. We're a partnership between the veterinary schools and the provincial, federal, and territorial ministries that are responsible for human health, agriculture, and wildlife. And we're affiliated with all the vet schools and also the Animal Health Center in British Columbia. And we conduct scanning surveillance to determine cause of death for wildlife. And that allows us to identify new diseases and to track trends over time. We also conduct targeted surveillance programs for pathogens that are of particular interest. And I'm just going to put one example up here. So the CWHC leads a multi-agency surveillance program for avian influenza. And for this program, we collect samples and they're submitted for avian influenza testing. And the idea is that we'll collect these samples from across Canada to try to detect strains of avian influenza that are of concern for poultry producers or for public health. And the ultimate goal is to try to provide an early warning of these strains occurring in wild animals before they get into the poultry flock. Okay, so these activities are a good start, but even in Canada, there are issues with regular sustained funding and support for wildlife health surveillance and response, and it leads to gaps in our knowledge and ability to handle and deal with wildlife disease. So the CWHC has been working with its federal and provincial and territorial partners to champion a pan-Canadian approach to wildlife health. This has been approved by all government. Approach to strengthen. Sorry, can you hear me?
It's a little bit muffled, Claire. I wonder if we can try turning off our cameras. Would that be helpful?
Maybe I should turn off our cameras. Yeah, I'll try that. I can't even blame the kids. Is that any better?
It's okay. Do you want to try again?
It's okay. Do you want to try again? Yeah, it says my internet connection is unstable. I was just saying it's a shame because I can't even blame the kids because they're at school, but here we go.
It is much better.
Is it any better, Jane?
Yeah, it is.
Okay, good. I'll keep going. and I'll assume that you heard most of what I said for this slide. It's just that the Pan-Canadian approach has yet to be implemented, but if it is implemented, we're hoping that it'll support additional efforts to really strengthen our capacity to identify, so that surveillance part, but also respond to wildlife health threats, and not just for public health, but also for conservation and agricultural health as well. Okay, so in addition to surveillance, there's a recognition that we need to apply a One Health approach to disease response. So, for example, with avian influenza, instead of trying to, get rid of birds or eliminate birds, there's a recognition that we need to, sorry, I'm just seeing in the chat, is it still really bad, the sound?
It sounds fine to me now.
Okay, all right, maybe I'll keep going. Just shout out if you can't hear me. Okay, there's a recognition that we really need to apply this One Health response to disease issues as they occur. So, if we detect avian influenza in wild birds, there's we shouldn't go out and kill all the wild birds to prevent the disease from being transmitted, or the pathogen being transmitted to poultry or to humans. We need to use public education, improving biosecurity. And if we want to do that effectively, we need to get buy-in from our stakeholders. And so there's really a need for research to better understand motivators for all these control measures, including biosecurity in the case of farms during avian influenza outbreaks. And there's also a need to understand, how we get producers and other people to support the strategies that are being put in place. It's also important to note that policies to promote wildlife health, while at the same time providing messaging to protect public health, are beneficial for both human and animal health. For example, researchers have found that acknowledging the benefits of bats in risk messaging led to greater intentions to adopt recommended rabies exposure prevention behavior without unnecessarily stigmatizing bats. And in this example here, you can see that in addition to telling folks to be careful and stay away from bats and what to do if you have contact with the bat, the authors also have a lot of information about why bats are important and why bats themselves are under threat. So that information can be really valuable, and that I think really shows a great One Health kind of response to a wildlife health issue or and a human health issue as well. Okay. So that all sounds great. We can see the links between wildlife, domestic animals, and human health. And I hope I've convinced you, or at least started to convince you, that we need to move towards this more proactive approach that it takes into account all these different components of One Health. But I haven't talked about the environment yet, and I'm going to do that a little bit now. And this is my next change to the diagram. So I've modified the One Health diagram again. This time I've put environment around all the different components. And for me, this kind of better illustrates the encompassing impact of the environment on humans and animals, and vice versa, our impact on the environment as well. So we're going to move on to consider the role of the environment in One Health and how we can move towards achieving the goal of One Health, which is this optimal health outcomes for people, animals, and the environment. So we know that many emerging zoonoses originate in wildlife. And when we look at the factors that lead to disease emergence in humans, we can see that there's a number of environmental factors involved here. If you look at this figure, you can see climate change and weather there, but encompassing a large proportion, about 31%, is land use changes. And it's estimated that land use change has been associated with the emergence of about 31% of new diseases reported since the 1960s. Okay, and it's also important to remember that wildlife populations can also be impacted by emerging pathogens, and that pathogens of wildlife, livestock, and people can directly threaten biodiversity. And these pathogens, emerging pathogens in wildlife, are driven by the same factors that drive emerging diseases in human populations. And this photo here shows a bunch of dead frogs that have died from chytridiomycosis. And it's thought, at least in part, that chytridiomycosis was spread globally through the wildlife trade. Okay, and it's also important to note that many of the factors that lead to disease emergence also threaten biodiversity, including climate change, land use change, and unsustainable exploitation or consumption of wildlife. And so I think that's really, really telling that all these factors are kind of coming together, and they're all related, and they're all related to the environment. And when we think about land use change, it includes a range of human activities and their impact on the environment, including human settlement into primarily wildlife habitat, urbanization, and deforestation. And the destruction of habitat and the encroachment of humans and livestock into new areas provides these new pathways for pathogens to spill over and for disease transmission rates to change, or disease transmission pathways to change and affect humans or domestic animals. And it can also lead to biodiversity loss. So land use change is linked to biodiversity loss, and biodiversity loss itself can lead to disease emergence when wildlife that adapt well to human-dominated landscapes also harbor pathogens that pose high zoonotic disease transmission risk. And finally, land use change also creates synergistic effects with climate change. For example, burning of forest to clear land. Okay, so climate change has been implicated in disease emergence. And just by way of an example, this figure here shows the projected range expansion of Ixodes scapularis, which are the vector for Lyme disease in Eastern Canada. And you can see, the estimated year of establishment based on some modeling that they've done that's really related to temperature change as a result of climate change. So that this tick is moving into areas that it wasn't previously thought to be able to survive in as a result of climate change. The impacts of climate change, including mega fires and floods in some areas, will also contribute to future pandemics by driving the movement of people, animals, including pathogen reservoirs, in ways that lead to new contacts among species and disrupt natural host pathogen dynamics. Okay, so when we look at these underlying factors like land use and climate change, it becomes clear that it's not going to be enough just to, improve our surveillance activities and our response activities. So we can't just focus our efforts on identifying and stopping disease transmission at the wildlife-human interface. If we really want to, achieve optimal health outcomes for people, animals, and the environment, we need to address these underlying environmental factors. And when we look at these factors that lead to disease emergence, if we just go back to disease emergence specifically, but also the same factors that are associated with animal emerging diseases and biodiversity, we can see that they're all caused by human activities and the impacts of these human activities on the environment, which is, of course, really depressing, but it perhaps also a source of some optimism, because we could deal with these problems if we chose to make it a priority. So there's a lot of interest now in this idea of transformative change. And so in addition to implementing a One Health approach nationally and globally to improve disease surveillance and improve disease control across human, animal, and environmental sectors, there's a recognition that we need to find a way to start addressing these underlying drivers of emergence, and that the IFBEST document provides some guidance in this regard in terms of suggesting policies that we could put in place to reduce the role of land use change and other factors in disease emergence. So some examples include incorporating considerations of health impacts into land use policies and planning. And then also this idea of having pandemic risk health impact assessments prior to major development projects. So I encourage you to have a look at that document. There's some interesting points there. The other area that they focus on are policies to reduce pandemic emergence related to the wildlife trade. And when we look at the wildlife trade, we already know there's, folks doing surveillance. We know that these are high risk areas for disease transmission. There's obviously, impacts on populations of endangered species associated with some of these markets. And there's also animal welfare issues associated with these markets. So lots of issues there. And it's not going to be enough, to just sample animals and humans and try to get an early warning about disease emergence. That's important, and we need to do it. But really, there's an increasing call to stop the trade of wildlife. And we'll need to address the issues that are associated with these markets, right? We need to recognize that there's folks that rely on these markets for their livelihoods. Food security may be an issue in some circumstances. So there won't be easy answers to these questions. And I think using a One Health approach will be key here. The recognition of all the components of One Health, the emphasis on this collaborative and transdisciplinary approach applied at local, national, and global levels will really allow us, if we choose to, develop effective control strategies. Okay, and really, the time to implement these changes is now. I think the pandemic has clearly shown us, this SARS-CoV-2 pandemic has clearly shown us the risk of not addressing these underlying processes. And the Intergovernmental Platform on Biodiversity and Ecosystem Services, so this IFBEST workshop report on biodiversity and pandemics, estimates that the cost of dealing with the pandemic as of July 2020, so quite a while ago, was already somewhere between 8 and 16 trillion US dollars. And the estimated cost, which I've shown on this slide here, with implementing global strategies to reduce wildlife trade and land use change and increase One Health surveillance, are somewhere around 22 to 31 billion. So not insignificant amounts, but like orders of magnitude less than what we have to spend when we're dealing with a pandemic. And just a note that if we took into account the benefits of reduced deforestation, on carbon sequestration, if they were all included in that estimate, that this cost would be lowered. Okay, so this, at least in my mind, provides strong economic incentive for transformative change to reduce pandemics. And I think now is the time we need to apply a One Health approach, not just to benefit human health, but in recognition that of this interconnection, to really see this interconnection and allow it to really benefit, humans, wildlife, domestic animals, and the environment all at the same time. And I'm just going to return for a moment to our muskrat case that I started with. And although there was no sort of immediate interest or One Health response to this outbreak, we're now working with colleagues within the Ontario government to kind of investigate environmental issues that may be underlying the disease outbreaks that we've been seeing in these muskrats. And I'm excited about this. So I'm hopeful that we are seeing the value of a One Health approach in Ontario, and I think we will globally. And I think this pandemic has been the kind of impetus to make that happen. And I think we need to make sure that it does happen. And that's it. Thank you.